They're a go-between. They might advocate on behalf of another group or an individual.
Well, when Joanna has a training with a group in the Latino community, we usually go together. And if I have a thought about something that Joanna hasn't mentioned, I may tell her what it is, and then she'll translate it because I don't speak Spanish.
We help each other like that, even though she might not understand the whole presentation that's going on. But I said, Rose, they want to know this, and that. Some question that I don't know, and I said, do you know about this? And she said, oh yes, and she goes and explain it, and then I translate it to the parents and everything. We help each other that way because Rose got more experience than me because I'm kind of new starting with this SIDS presentation.
Who can be a cultural broker? You know, it's not a job description yet that we have in many of our organizations. The cultural broker is a liaison. They make that connection between you and another organization or a community. They're a cultural guide. They can help you understand the culture that you're connecting with so you don't make those mistakes and faux pas. And they can help the community understand a little bit about the health culture so they understand where you're coming from and why you're approaching things in a particular way. They can act as a mediator. As Tawara mentioned earlier, when we bring people together from different backgrounds, there can be conflict, and that person may be able to mediate that because they understand the perspectives of both sides, and they can be a real catalyst for change. Now, what are we looking for? Somebody who's how do you know if somebody's a good cultural broker? You know, it's not just because they live in that community or you happen to know them and they're like the people you want to work with. They have to have the trust and respect of the community you want to work with. I mean, that's the first step. You know, if instead of your best friend who you trusted who walked up to you on the street, it was somebody who you thought was a little shady, you're not going to go to dinner with them because you're not going to trust them. They have to have knowledge of the values, beliefs, and health and mental health practices of the cultural group you want to work with. They have to understand any traditional and indigenous wellness and healing networks in the community, because remember we said we really need to work with them. They have to also, though, have experience navigating the health and mental health care delivery and support systems. So they really have to know your system as well. Otherwise, they can't make that bridge. Now, it could be any number of people. You see a list here: social workers, interpreters. You might have a board for a program you're working on. A board member might be a good person, a healer in the community. It can be youth, it can be advocates, it could be a nurse or a physician, it could be an administrator. It could be, their official role is not as important as that list of characteristics that we talked about. Of course, again, we have some principles that underlie cultural brokering. It has to honor and respect the cultural differences, it could be community-driven, provide it in a safe and non-judgmental and confidential manner, helps service delivery, or in our case training, be accessible and tailored to the communities it serves, and again acknowledges the reciprocity and transfer of assets between both the health system and the community. So for somebody to be a good cultural broker, we want them to have some attributes that make sense, some skills, some knowledge, some awareness. In terms of awareness, we want them to be aware of their own cultural identity, because they're almost acting like an interpreter or a translator between the culture that they're coming from and the health culture. So they have to have the self-awareness to know, you know, Tawara talked earlier, normally you're behind the mirror when it's your own culture. You don't see your own culture. So we have to have somebody who's come out from behind the mirror and is looking through it with everyone else. They have to have an awareness of the cultural identity of the members of their community. They have to understand the social and political and economic factors affecting their community. In terms of knowledge, they have to have a knowledge of the values, beliefs, and practices related to illness, health, mental health, well-being of the cultural groups. They have to know about traditional or indigenous mental health care networks. And they have to know the healthcare system, and they have to understand the health promotion information. This is a big order, you know, for somebody. But when we can find and work with those people, it really makes us far more effective in our work. And then there's actually a skill set that goes along with this. They have to know how to communicate in a cross-cultural context, understanding that, there's going to be glitches and knowing how to smooth that. Communicating, if the community speaks another language, obviously in 2 or more languages. They have to know how to interpret or translate information, not just the words, but really, if I'm talking about something related to health, they have to know how to frame that so the community will resonate with what I'm saying, and vice versa. As the community talks about a particular issue, they have to know how to frame that so I, as a health person, am going to make sense of it. They have to be able to advocate. They have to be able to negotiate the delivery systems, and as we mentioned, mediate and manage conflict. So really an important piece of our work is trying to find and identify these cultural brokers within a community. Because again, we're always looking for the credible voice when we're doing health promotion. Interestingly enough, cultural brokers or credible voices, and I want to talk about credible voices particularly, we can't make assumptions about who that's going to be in a community. It's really empirical. And I have to share with you a story of a colleague of mine. He's an African-American mental health professional, and he was going to work, and he's from DC. He was going to work in Baltimore on some community mental health projects. He got there, he kind of thought, well, we're all kind of the same. They're going to accept me right away. What he didn't realize was the cultural pieces, not the racial. Remember what I talked about? There's a difference between racial identity, cultural identity, was that for people from Baltimore, somebody from DC was an outsider. Just plain and simple. It didn't matter what he looked like, he was an outsider. And worse yet, he was working with the university, and that made him even a little bit more suspect. So he realized he had to make a connection in the community, find the credible voices, find the people who he could work with as a cultural broker. So he looked for the usual kinds of leaders in the community. He talked to political leaders, he talked to religious leaders, and he was still kind of getting nowhere. Finally, somebody told him there was this one guy in a community development agency who really had the hearts and minds of the community. So he went to meet with him. Now imagine his surprise that this man was not African American at all. But because he was a key person in that community, it turned out he was a credible voice. So we have to learn from the community who, at that moment, is the person that they're going to look to. And we can't make assumptions about that. When you're planning for community engagement, you almost want to have a checklist and think about the following things. In the community where you want to work, think about your current contacts, individuals. Who do you know there? You can begin talking to, finding out from them more about the community, more about their beliefs. Who might be good as cultural brokers? Who can you connect with? Sometimes, though, if it's a community we don't know well, we don't even know individuals. And so then we can start with organizations that we know about. Start working with them and work through that to get to individuals. We then want to get a sense of the credibility of those contacts. And we have to do that by asking questions in the community. Questions like, if there's a problem in the community, who do people go to? If people need information, who do they ask? Those kinds of questions. And so then we want to figure out who might be potential cultural brokers that we can connect with, and first have to build that relationship before we move on to the community. And then lastly, we want to make sure we understand any concerns or issues the community may have about our own organization. Because there's nothing more difficult than, you could be the best, most culturally, linguistically competent, whatever, health promotion trainer in the world, but if you're associated with an institution that community really has issues with, it's going to be very difficult to be successful. And so you want to know what those issues are so you can acknowledge those up front with the community and work through that.